Probably not true, but it is nearer to the truth nowadays, right? It's not fully the complete picture. The second thing you want to remember is we all think in a logical way, not logistical way, logical way. That is, if this happens, then if A happens, then if I do correct the A, then I will be all right. That's how we all think, right? Say, for example, we think that what causes back pain? The disc is out. That is the A I am talking about. Then if I put the disc inside, then everything will be good, right? So that's what I mean by logical thinking. Why do I give antipyretic drug? Because I have fever, so this drug will reduce the fever. So this kind of logical thinking is what ruins medicine. That's absolutely nonsensical to think like that in medicine. You may be thinking logical thinking is the highest form of thinking, right? But the problem with logical thinking is you don't understand the whole picture ever. You will never know it completely. What is the pathology? What is causing all these factors? Because as I told you earlier, this is a complex system. What is a complex system? There are many parts. That's what is a complex system. Remember, your bike is not a complex system. It just has many parts. But sometimes a lot of systems are complex. There are many ingredients and they form a whole, right? One of that is pain. Pain is not because A is compressing B, then you get pain. It's never like that. It is far more complex. Why are you feeling sad? It is not because a part of the brain is affected. That doesn't happen. Even language areas, which we think is the reason why you are speaking, the language area, the Broca's area, all these things are completely nonsensical. Language is not produced in only one part of the brain. It is just a correlation that if that region is affected, your language is affected. That is not a casual pathway, because language is far more complex for you to speak. It is a cognitive motor function. You need motor function. That is my speaking is not just my thinking. It's also moving my mouth, my vocal cords. A lot of motor activities are there. So the motor cortex has to work. If my motor cortex has to work, my basal ganglion has to work. If my basal ganglion has to work, you can get the picture. The whole thing has to work. It cannot be just one part is doing that. Right? So that kind of nonsense keeps on going in medicine. So we think that, okay, logically that this is the problem, so I will find a solution. And that is our default way of thinking. Remember, what are the questions did you ask when I finished pathology is, what causes stiffness? Right? We didn't ask, how can I remove stiffness, right? We asked, what causes stiffness? Why? Because we think that if I know the cause, I can remove the stiffness. But as I told you in the first lecture, there is no causal relation in medicine most of the time. Am I clear? This is not leading to this. So most of the time, this way of causal thinking, this way of logical thinking will be always flawed, and it will always lead to poor treatment. Right? Not all the time, as I told you, it's always a probability, not all the time. Closer to truth, there is never black or white. It is not always false, but most of the time it is false. Am I clear? Right? Just because, say for example, I'm not sure what's your name, but we will assume. Okay. Akshay. Akshay goes there and he meets a homeless person, right? And he is giving money. And out of his goodwill, he is giving some money. Right? Can we say he's a good person? உனக்கே ரொம்ப டவுட்டா இருக்கேப்பா. Right? We can say he's a good person in that particular situation. He can go and meet his girlfriend and kick her. ஏன் அவ்வளோ லேட்டாக வந்தேன்னு உட்காந்து கால் கத்திருக்கலாம் இல்லையா? சரியா இல்லையா? எக்ஸாக்ட்லி. கேர்ள் ஃப்ரெண்ட் இருந்தால் அடுத்த பிரச்சனைன்றியா? So we are, for that particular period we behave in a particular manner. Likewise, for that particular manner your pain is nociception or thatception, deception. All these things are mostly rubbish. Pain is pain. It is difficult to say it is because of nociception or because it's central pain or because it's the change in the brain. It is mostly all three. It is never separate most of the time. But we assume that most of the time in acute it might be more nociception, may be a bigger issue rather than your brain. But that again is not true, because without the brain you can never feel the pain. Right? And brain is not a single organ. It's a complex organs of hundreds of chemicals swimming and lots of things happening which we don't have the slightest clue what is happening. The neurophysiology we learn is mostly very, 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 very rudimentary. Very rudimentary. We don't have a higher understanding of how your brain makes you feel, how you are thinking that what is wrong with this idiot, he is talking something, right? Or you are thinking, oh my God! All these things, you don't know how this is happening. Likewise, we have very little understanding of how brain produces pain or how the patient feels, because he is feeling and you are just listening to him. He may not be able to tell you the exact picture, right? I and Jayanti have some issues with our brain. She has probably we will call it a different type of problem, and I have a different type of problem. You will never understand what we are going through. You will never understand what we are going through, because the brain is a complex organ which produces the feeling of I, and that is difficult to make other people understand, right? So what is the solution then? If I am not thinking logically, that is A causes B, so I should be careful. How can I think? Remember, most of the time you have to think logically in your life. யாராவது குறுக்க வர்றாங்க அப்படின்னா லாஜிக்கலாக நீங்கள் என்ன பண்ணணும்? அவன் அடுத்து இந்த இடத்துக்கு வந்துருவான்னு சொல்லி பிரேக் போடணும் இல்லையா? அவன் வருவானா இல்லையான்றதெல்லாம் ப்ராபபிலிட்டிங்க, அதெல்லாம் நாங்கள் வந்து அதை பற்றி இப்போ யோசிக்க முடியாது அப்படின்னு you cannot say like that, right? So logical is the way our evolution helps us to think, but we cannot think like that in medicine. We have to think in sort of different way. We will call for brevity, or for convention we will call it empirical way of thinking. What I mean by that is, if this treatment is working or not working, that is how we want to think. If I do this drug, is my patient getting better? If I do this exercise, is my patient getting better? Is how you want to think in for a clinician, not for a scientist, for a clinician. Am I clear? Most of the time logical thinking will help you, but not always, right? Especially in medicine, I think logical thinking ruins a lot of things. That's why you keep on saying that you can see there is a trigger point here. Logically what it means is I have to remove that trigger point to get it over with. That is why we have so many idiots who are teaching trigger point in this country and around the world, because they have a poor brain which is not fully developed, right? How many of you are below 25? How many of you still recklessly drive your bike? Oh, come on. You drive, right? No? Do you jump around recklessly? What is wrong with you then? Do these things. You can't do that when you are older like me, right? Now, one of the things you will see that or understand is the brain is not developed until 25, right? You are still kids. One of the regions which is not fully developed is your frontal brain, right? The frontal brain is what makes you think, what makes you stop doing stupid things, right? If you have a bike and if you want to drive at 80 and then you see a policeman there and you are like, what, right? So that is your frontal brain. And as you get older, people stop doing reckless things, right? That is because your frontal brain fully developed and it starts connecting your limbic brain, that is your primitive brain. That connections between your frontal and the limbic system gets stronger and stronger, and you behave like an adult and you are an ass for the rest of your life. Until 25, you are a human being, enjoy life. Afterwards, you will be a proper ass, sometimes with a hole, without a hole, or something like that. So enjoy life until 25, right? So when you are able to control a lot of things with your frontal brain, that is where a lot of treatment gets very difficult, because a lot of things can be controlled by our patients. That's what we was talking about, nociception, nocebo and placebo, right? So when you are giving a treatment, there are so many factors which are working. It is not just the medicine or just the exercise. It is a whole complex system reacting to it. How do I know that? For that, I have to see whether the patient has got better after X number of days in reference to other people with other treatment. Not by correlating whether the pathology is changed. Am I clear? How do I know my fever is gone? Simple. Am I clear? How do I know I am dead? My pupils don't react, right? That's how I know I'm dead. That's all. You don't need to do a complex medical test to find out whether I'm dead or not, right? So you want to find out whether something is working or not based on real life scenario. Real life scenario, whether my patient after the treatment gets better, not just by logical thinking. Logical thinking is what led to manual therapy, what led to electrotherapy, what led to TENS and all those things. And we all know that nowadays it is very, very clear most of them don't work because it is a product of logical thinking, not empirical thinking. That is, did it work on my patient? Am I clear? So if you are looking for a treatment, Nalladin Kalayila we were talking about whether it's a good treatment, right? An adjective. If you want to know whether a treatment is beneficial for your patient, whether it will stop him from dying, stop him from going to the hospital or recovering faster, going home, right? Or he is able to run faster, climb stairs. If he is able to do all those things after your treatment, then you need to say that it works, not based on your change in the pathology. Why? Because the X-ray before and after a treatment will always be the same, right? That's why one of the most comedic thing during pandemic is CT scan of the CT scan of the chest. I had 25, I had 12, I don't know what that number means, but people kept on saying, and I was thinking, I, a physiotherapist who has poor education in physiotherapy and very poor in medicine, I know that film is nonsense, but a guy with DM education in radiology, which is the most difficult thing to get in, can't understand because we don't understand medicine. Medicine we think in logical way. Now, right. As I told you earlier, Buddha itself told that what you see is absolute nonsense. That is not a causal pathway. Am I clear? Causal pathways are the most difficult thing to find out in science. If you are finding out something like that, probably you will get a Nobel Prize. But you go and see, mostly Nobel Prize are given for things like that. Say, for example, what causes ulcer? Ulcer, right? The ulcer people. H. pylori. They got the Nobel Prize because they found out the causal relation between H. pylori and the ulcer. Until that, we were all thinking that, and we were very, very sure ulcer is caused by not eating properly, not eating on time, and stress. Right? So, causal relations are difficult. So, think of what works best. Why I am talking about all these things? Because I am going to tell you only one answer for the treatment for OA&E. Make your patient jump and run and do all sorts of things. Isometric exercise is one of the nonsensical things. Why? Because you want to move the joint. அதனால தான் அதுக்கு பேர் என்ன வச்சிருக்கான்? Joint and பேர் வச்சிருக்கான். இல்லையா? If it's a joint, what should its function be? Moving. அதை ரெஸ்ட் எடுக்க வச்சோம் அப்படின்னா இட்ஸ் லைக் சேயிங் இன்னைக்கு ரொம்ப இப்போ நீங்கள் உங்களுக்கு ரொம்ப உடம்பு சரியில்லை, உங்களுக்கு வந்து டைரியாவாக போகுது அப்படின்னா என்ன அர்த்தம் அப்படின்னா வாயை மூடி வச்சிடணும் அப்படின்னு சொல்கிற மாதிரி. Does it make any sense? Right? காலில் வலி இருக்குன்னா என்ன பண்ணணுமா? சும்மா உட்காந்துக்கணும். Right? It may be true if you have a fracture or a traumatic injury because we know the pathology is slightly different. We also know that it's not just the pathology. If you walk with a broken leg, it gets worse. So we have a logical thinking as well as an empirical statement to say that if I walk with a broken leg, it becomes worse because I know my pain is getting bigger and bigger. Right? So all this understanding that the joint has gone for a wear and tear is what led us to think that the joint has to be protected. So we do isometric exercise. And the joke is, how did the patient come to your hospital? Walking. But we don't give walking as a exercise. Can you see the cyclic way we are thinking? This is a cyclic way of thinking nonsense. He is coming by walking, but no, you should be doing isometric exercise. And that too, for how many times do we do isometric exercise? 10 repetitions, because 10 is a very important number in physiotherapy. 10 illana sette peruvom ellarum. Right? 10 repetition is very important. So this doesn't make any sense in logically also. But empirically, what does it mean? Do cycling, do walking, do squatting. What happens to your patient? They have seen in patients who have not done these things, right? Who have not done isometrics. I mean, they have done probably isometrics and shortwave and whatever way we can think we can get it into. And they have done the other group of people, they were doing exercise like squatting, sit to stand from a chair, cycling and all sorts of things. They got better. Now, as I told you, you should not use a adjective. Better is a adjective. Better than what? They were better than the other group of people who wouldn't do all these exercise. How much they were better? If their VAS score in the people who didn't do exercise is 4, in the other group they were 2. So there were difference of 1 or 2. They also got better in their function. How much better? Probably like that, 2 or 4 in a particular scale. They were able to, you know what's a OMAC scale? If you don't know, go and see a OMAC scale. In the OMAC scale, they got better than the other group who didn't do exercise. Right? Again, what exercise? Stepping, cycling, walking, these things are, as Saravanan was alluding that, closed kinematic chains are far more better. Right? And did their life got better? The quality of the life, that is the basic indicator of a human person, right? So if your life got better, again it seems they got better. Naturally they got better because they were able to walk more, they were able to walk on stairs, walk longer. Probably they also thought that their life is better. Am I understood? Now, as a clinician, you can stop here itself. That is, you don't have to know why did they get better. How did they get better? What may be the relation between this and that? You don't have to know. but it is better if you know that also. Am I understood? Now, here you need to understand you can only hypothesize what might have happened to make them better. You cannot know properly why they got better, because the experiment is not to find out why they got better, it is always to find out that whether they got better. Science never, most of the time, does not tell you why. Right? Remember Newton's apple falling on the head? He's not talking about why, he is telling you or defining gravity, how the force is, and it leads to a prediction of it. Right? So if I have a patient now, I can predict that if he has undergoing a 4 to 6 weeks of an exercise, which is close kinematic chain, probably, not always remember that, probably he will get better in his pain, better in his quality of life, and better in his disability. How much? Probably from 2 to 4 in your VAS scale, similar thing in your WOMAC and quality of life. Am I clear? So what is science? Science is the ability to predict that. Right? If I know F is equal to ma, right? You know that F is equal to ma. So if you want to know the force, what you need to know is you need to know the mass and acceleration. If you don't know the acceleration, if you know the force and mass, you can know the. So that is science. So likewise, what is science in clinical sense? That is, I can with some amount of confidence say that if you do this exercise, you probably, again never use you will, it is you will probably get better. Right? Who are the patients who will not get better? Probably are patients who are having a chronic ONE or severe ONE. Am I understood? Severe ONE. It's difficult to define also severe ONE because they define with an X-ray. Again, you can see the problem in that. The X-ray does not really tell you whether it is severe or moderate, but that's how we are doing it. So it's not very clear. But if you have severe pain and it's been there for years together, probably your exercise might not work as good as other patients who have probably for 2 months, 1 year, that kind of patients, 2 years, and they have okay pain, 6 to 7 in the VA scale. They will be able to. This is what we know for today. It might again change with time, change with experiments, but at this point of time, that is what we know. Am I clear with this? Right? So this is one part of the pain. Now, the first thing you want to understand, as I told you, how can this lead to these changes, right? Now, again, the problem is, whenever I say exercise for your lower limb, whether it is the patient or the doctor or physiotherapist, they all tend to think that it is a strengthening exercise, right? If I do this for 100 times, we all think that it's a strengthening exercise. It strengthens the muscles. There is no question it strengthens the muscles, right? But the muscles are attached to your bone, so their bones are going to get stronger, right? And the muscles are innervated and activated by your brain. The blood vessels are activated via your the autonomic nervous system, and all the other hormones are influencing your increase in the muscle mass, changing. So the whole body changes when you do an exercise. Your brain changes. That is one of the most important thing as a physiotherapist to understand. You are not changing muscles. You are changing a human body. That is what I told you is a complex system. In a complex system, you cannot change one part. The whole thing will change. Am I clear? Right? So, when you are doing exercise, you may be desensitizing. We were talking about the sensitive nervous system in pathology, right? So, you may be desensitizing the nervous system, right? You may be forming a lot of stronger connection between your frontal brain and your limbic system, and your descending pathways may get better. That is, your inhibitory pathways may get better, they may get stronger. That is, plasticity of the brain also happens when you are doing exercise. Am I clear? Again, so don't think of what happens inside the joint. That is just a small part of what is happening. What is happening is your whole body is changing. It's not only for ONE, anything, your whole body is changing, right? Whenever you are learning something, your brain is changing tremendously, right? So, depending upon what you are learning, your brain is changing. Say, for example, if you are learning maths in school, right? What gets better? Why are we learning maths in school? Problem solving. Exactly. Lot of idiots tell that, what am I going to do with calculus? You are not going to do anything with calculus because you are going to work in a Swiggy. You are an idiot with a car or a bike. That is not the point exactly. Some people go to use calculus, not us. We are idiots, like the Swiggy players, right? So, what it helps you is in solving problems. So, that part of your brain gets better and better. So, what I am doing when I am doing this exercise, it's not just this is alone is changing. I am learning to move with my pain. What it means is my joints are changing, my muscles are changing, my brain is changing. The whole system is changing. Am I clear? Right? So that's why logically, if you think that and see the X-ray, nothing has changed. It is like that because you cannot take any picture of your whole body to find out what are the things which have changed. Am I clear? If you go to school from 1 year to next year, not college, you have become dumber and dumber after. When you finish college, you will be the dumbest person. When you enter the college, you will be probably the most intelligent, right? Now, in the 11th and 12th, you will probably change, right? A lot of things changes. How will I know you have changed? I don't have the slightest clue how you will know. But you know you have definitely changed. You can measure it for a particular outcome. Okay, did you do max better than 11th and before starting 11th and after finishing 11th? You have. Pass another 12th and 40 mark அதை எடுத்தாகணும் இல்லையா? காலேஜ் வந்தால் பிரச்சனையே கிடையாது. நான் முன்னாடி சொன்ன மாதிரி ஏபிசிடி எழுதுனீங்கன்னா கூட வாத்தியார் பாஸ் பண்ணி விட்டுருவாரு. வாத்தியார் பாஸ் பண்ணி விடலன்னா அவரை தொட்டி விட்டுருவாங்க. So we have learned something and the brain learns. So always remember that. That's why I keep on telling you logical thinking is not going to help. Right? So the last part of the treatment is, that's what I and he was talking about, the education part of it. As we all know very surely what causes low back, ONE is wear and tear. How do I know it is a wear and tear? Because I can see on the X-ray. As we all know, what we see is the truth, right? If you think like that, you are probably never going to be a human person. Leave alone being a physiotherapist, you are never going to be a human. What you see is always wrong. Always wrong, right? You can never see clearly. You should have seen a lot of experiments in your psychology, whether it's 2 us or 2 women. Remember that pictures when you were studying psychology? No? Really? You should have had this picture of whether it is 2 women or a vase, right? So it is never clear. Our visual system is not meant to do that. They are meant to give you always a skewed view of the world. You are not seeing the real world. Right? So for that, you need to use one important organ in the body, your brain. Right? Sadly, that is the difficult part to do As you know that you can do exercise today, especially you are all children basically. If you do 4 weeks of exercise, you can get strong muscles. 4 weeks of learning, you will be an idiot, bigger idiot than this week. And 4 weeks of BPT, you will be the king of not knowing anything, right? So it is difficult to use the brain, but that is where the trick is. And the trick is not to use logical thinking alone. The trick is to think empirically, whether it is changing. அதை வந்து நீங்கள் பார்த்து சரியும் தெரிஞ்சுக்க முடியாது, அதை எக்ஸ்பெரிமெண்ட் பண்ணி தான் கண்டுபிடிக்க முடியும். நீங்களும் நானும் பார்க்கவே முடியாது உங்கள் வாழ்க்கையில். ஒருத்தர் உங்களால் ஒருத்தர் சரியாயிட்டாரு அப்படின்னா it is definitely not because of you. It is definitely not because of you. This is like saying, how did I get 90% in your say for example in maths? Will anybody say it is because of your teacher? No, right? Because there is also another person who got 50 because of the same teacher and 5 because of the same teacher. Right? So if you really want to know whether the teacher is good or not, we need to say whether the whole class changed for the better. Not everybody. That's why again you can have only closer to truth, not the absolute truth. Right? For that you need to go and see what is the evidence. Again, all the surgeries other than replacement have failed, completely show that they are useless. Why? Because they believe that the pathology is inside the joint and they changed it. Say for example lavage, they will clean out the joint thinking that the osteophytes and the smoothness of the surface is the biggest problem. And they cleaned out and they found out that the patient was like, okay, it's clean, can I eat from the knee? Not really, you cannot walk. You still have the same pain. But logically it looks very good, right? Because you all told that osteophytes are the biggest problems, right? So you remove the osteophytes and you are seeing that nothing changed, because that kind of logical thinking is what is ruining medicine without the empirical evidence. So all the empirical evidence for surgery has proven that it's of no value, right? And the last part of the treatment, what we are going to do is about education, right? As we have clearly been enumerating again and again that it is not because of wear and tear. So don't be a intelligent therapist and intelligent doctor like millions of in this world and go and tell, நான் முட்டிலாம் தேஞ்சு போச்சு, அவ்வளோதான், இனிமேல் வீட்டிலே உட்காந்துருக்கணும், கீழே உட்காந்துங்க, அவ்வளோதான், இன்னும் தேஞ்சு போயிடும், ஒரு லாக்கர் கீக்கர் வாங்கி நீங்கள் நீ ஜாயிண்ட்டை பத்திரப்படுத்தி வைங்க அப்படின்னு சொல்லக்கூடாது. Am I right? You cannot do that, right? So the common example I give to my patient is, all of you have some sort of vehicle, right? A bike or a car. If you don't have, you are somebody. So how many of you have looked into your tire and said that என் டயர் தேஞ்சு போச்சு அப்படின்னு யாராவது போய் மெக்கானிக்கல் ஷாப்பில் போய் கொடுத்துருக்கீங்களா? என்ன பண்ணுவாங்க அவங்க? கழட்டி போட்டு வேற டயர் போட்டுருவாங்க, ரைட்டா? ரைட். ஸோ வாட் இஸ் தி டிஃபரன்ஸ் பிட்வீன் அ லிவிங் ஆர்கன் அண்ட் அ நான் லிவிங் ஆர்கன்? It cannot repair itself, right? So whenever there is going to be decay in your joint, it will repair. If it is not repairing, it means that you are not a living person. சரியா? That is the first thing you want to teach your patient. அப்படின்னா நானும் அவரும் அதான் பேசியிருந்தோம். எப்படினாலும் உங்கள் பேஷண்ட் எல்லாரும் எப்படி வருவாங்க அப்படின்னா தேஞ்சு போயிடுச்சுன்னு தான் சொல்லி வருவாங்க. ஏன்னா அங்கே ஒரு டாக்டர் பார்த்துருப்பாரு, அவர் பெரிய அறிவாளியாக இருப்பார். ஏன்னா அவர் நம்மள மாதிரி இல்லைல்ல, ஒரு 4 வருஷம் படித்து அப்புறம் 3 வருஷம் உட்காந்து கார்பென்ட்ரி வேலையெல்லாம் படிச்சிருக்காரு, ஆர்த்தோபெடிக்ஸ் வேறு படிச்சிருக்காரு, டாக்டர் வேறு போடுறாரு. அப்புறம் அவர் சொல்லாமல் அவர் சொன்னதை கேட்பானா, உடனே சொல்ல கேட்பானா, என்னப்பா? Right. So he will always come with this nonsensical idea that it's dangerous. So you want to make your patient understand that that's all right, you will again heal back. உங்கள் கையை வெட்டிட்டீங்கன்னா கை அப்படியே தனியாக துண்டாவே இருக்குமா? இல்லை இல்லையா? என்ன ஆகும்? சேர்ந்துரும் இல்லையா? அதே மாதிரி தான் உங்கள் உள்ளேயும் இங்கே தெரியுது, இங்கே தெரிய மாட்டேங்குது. ஓகே? And the other thing you want to remember is, with age everything decays. right? I am the only one above 40, but I am assuming your parents are also my age. How many of them are wearing glasses to read? Right? Because your eyes will slowly decay. Your heart will decay. பாப்பா ரொம்ப அழகா இருக்கு ஸ்கின் நான் பார்த்தேன்னு வச்சுக்கோங்க. இன்னும் 10 வருஷம் கழிச்சு பார்த்தீங்கன்னா இப்படியே இருக்காது. You will grow older. My hair was far better than what I have now, right? Because it all went away. After I got married, half of it went away. After I started working, most of it went away. Right? So everything will decay. That is the nature of a human body. எப்படி சாகுறது? இப்படியே இருந்து சாக முடியாது இல்லையா? We have to slowly decay and die. Your heart will decay, everything will decay. So decaying is not a disease. That is life. That is biology. Am I clear? நாய் வச்சிருக்கீங்களா? 10 வருஷத்துக்கு அப்புறம் அந்த நாயை பார்த்தீங்கன்னா பரிதாபமா இருக்கும். 14 வயசுல நாய் வச்சிருந்தீங்கன்னா எப்படா சாகும்னு இருக்கும். Because they will be old, nothing will work, mostly they will be sleeping, they can't see properly, they can't hear properly, all sorts of things, right? Because their age of living is probably from 10 to 15, probably 18. If you have a very poor dog, it will suffer more. If you have what's the dog with white and black spots? Dalmatian. Those are the worst kind of dog. Probably 4 or 5 they will die. Because they have a lot of genetic defects, they will definitely die. Right? That is the nature of biology. So make your patient understand degeneration will regenerate also. That is the way the biology is. That is not a disease. Am I clear? உங்ககிட்ட தான் முதல்ல வந்தாங்க அப்படின்னா நீ பெண்ணு சொல்லுங்க, முட்டி தேஞ்சு போயிடுச்சுன்னு சொல்லாதீங்க பெரிய அறிவாளி மாதிரி. சரியா? முட்டி தேயறதெல்லாம் வியாதி கிடையாது. Right? So when you are trying to educate, make your people understand that it is a joint. What is the function of joint? Moving. So the treatment should be moving, not just waiting. One of the common examples I tell my patient is, when will you secrete saliva? When you see food. When will your joint secrete whatever it wants to secrete? When it is moving. அதனால நீங்க பத்திரப்படுத்தி வைக்க முடியாது. ரெஸ்ட்ல இருந்தா உங்க ஜாயிண்ட் பெட்டர்னு நினைக்க முடியாது. Remember, this is a logical argument. It may be wrong or it may be right. But it is for the education of the patient. This is not about the exact truth. Am I understood? When will your cycle run properly? When you are தொடச்சு வச்சோமா அல்லது ஓட்டிட்டு போனோம்னா. And also remember, when your cycle is getting stuck, or if it is making sounds, or if it is stiffer, what you can do is you can put oil inside, lubricant, but you cannot do that. How can we do? We have to produce inwardly, inside my body. When will that be produced? When I am moving. My physiology happens when I am moving, not when I am just sitting around or just lying like down. Am I clear? And so that is the things about enablement. Enablement na enna arthona? எப்படி அவங்கள பெட்டர் ஆக்குறது, அவங்களோட பிரெயினை வந்து how will I enable them to make them move more, to make them manage their pain better for themselves. For that I have to teach them that the pain is not because of wear and tear. I have to move more, then only I get better. These are the things I have to say, right? What we call as the placebo effect. What does it do? Probably the frontal brain is understanding these things, right? that is ஓகே இவர் சொல்கிறது ஏதோ ஒரு உண்மை இருக்க பாரு தெரியுதே அப்படின்னு தான் நினைப்பாங்க எல்லாரும். நீங்கள் சொன்னோடனே எல்லாரும் வந்து ஐயோ இவ்வளோ நாள் எனக்கு தெரியாமல் போயிடுச்சே, இன்னையிலேருந்து நான் மாறிட்டேன் அப்படின்லாம் சினிமாவில் மட்டும்தான் சொல்லுவாங்க. Right? Nobody changes like that because we know that the brain takes time to change. Plastic changes happen slowly. அதனால சொல்லி கொடுத்தோன்னே யாரும் மாறிட மாட்டாங்க. அதோட அவங்களும் நீங்களும் சேர்ந்து எக்ஸசைஸ் பண்ணணும். When both of this happens together and if they see some sort of reward, what I mean by reward is reduction in pain, some sort of ability to walk more, then your brain will start to slowly change. What I mean by brain here is the whole body. Am I clear? So it's a continuous process. It is not a one-day process. Clear? 4 நாள் போயிட்டே இருக்கும், நல்லா போயிட்டே இருக்கும், திடீர்னு ஒரு நாள் 5ஆவது நாள் வரும்போது அதிகமான பெயினோட வருவாங்க. This will happen because again we don't have the slightest reason why it goes up and why it comes down. We don't know the causal reason for that. Again you need to go back and tell that this is how the nature of the disease is. இதை முன்னாடியே சொல்லிட்டீங்க அப்படின்னா இது வரும்னு எதிர்பார்த்தாங்கன்னா most of them will then accept you. வந்ததுக்கப்புறம் அப்படிதாங்க சில நாள் வரும் அப்படின்னா அவங்க என்ன நினைப்பாங்க, இப்படியே எதுனாலும் சப்பக்கட்டு கட்டுவாங்க அப்படின்னு தான் நினைப்பாங்க. That is why I told you science is about prediction. If you already are able to predict it, you are more chances to accept it. If I know that this might happen, sometimes I may be anxious, but slowly it will sink in. After 2 or 3 times when I get that cycle which goes upwards, I will be like, okay, this is the nature of the disease. If you have anybody who has migraine will know that sometimes it's worse, sometimes it's good. After 1 year you will know that if you are seeing say for example a Rajini movie, you will end up with a migraine, right? Or Shiva Karthikeyan, yeah, right? It's like somebody is poking a sharp object into my eyes and touching my frontal brain. I don't know, but I suppose children are happier with it. Anyway, so you want to make them know that this is how will happen. எப்படிங்க நெகட்டிவாக பேசுறது அப்படின்னா that is the biology. That is the probability I am talking about. யாரும் அவங்ககிட்ட வந்து ஓடி போயிட மாட்டாங்க, கவலைப்படாதீங்க. Right? Right. The what is the nocebo part of it? What are the things I should not be saying so that I am activating my limbic system rather than my frontal brain? Again, I may be activating my frontal brain also, but I may be activating more of my limbic brain also. The first and foremost is எலும்பு தெரிஞ்சு போச்சு, எக்ஸ்ரே காமிக்காதீங்க. One of the stupid things to take X-ray is for ONE. என்ன தெரியும் எக்ஸ்ரேல? பேஸ் குறைஞ்சி போனது தெரிஞ்சிருக்கும். நான் முன்னாடியே சொன்னேன் இல்லையா, இப்படி வந்தால் அவன் பேர் என்ன? ஆமாம். இதுக்கு என்னத்துக்கு எக்ஸ்ரே எடுக்கணும், எதுக்கு எஸ்டி கவ் எடுக்கணும்? ஏற்கனவே தெரிஞ்சிருச்சுல ரிஸ்ட் அப்படின்னா என்னத்தை கிளிக்க போகிறோம், அதுக்கப்புறம் ஓஎனின்னு தான் தெரிஞ்சிருச்சுல, அப்புறம் எக்ஸ்ரே எடுத்து ஸ்பேஸ் குறைஞ்சிருச்சு அப்படின்னா அதுதான் படிச்சுட்டேல பேத்தாலஜி புக்லேயே. அப்புறம் என்ன இன்னும் நீங்கள் படம் எடுத்து என்ன காமிச்சிட்டு இருக்க, என்ன காமிச்சிட்டு இருக்கோம் அப்படின்னா ஒரு எக்ஸ்ரே எவ்வளோ சார் இப்போ காசு? 500 to 600, 30% எனக்கு காசு. அதுக்கு தான் அந்த எக்ஸ்ரே. சரியா? எம்ஆர்ஐ எதுக்கு அப்படின்னா 3000 ரூபா, அதில் இப்போ 30 to 40% நிறைய காசு. That's why I am saying that. அதுக்கு தான் வந்து அப்போ என்ன சொல்றேன்னா, you tell them that அது குறையும் கூடும், இன்னும் கொஞ்ச நாள் கழிச்சு எடுத்தால் கூட தான் செய்யும். Because as I told you, you want to make them understand about healing and degeneration. It is not easy. It is going to take time. ஏன் அப்படின்னா எல்லாரும் ஒரே மாதிரி சொன்னால் தேர் வேமா நகலும். ஒருத்தன் பின்னாடி இழுத்துட்டு இருக்கேன், நீ முன்னாடி இழுத்தேன்னா அப்படி தான் நகலும். But that is the way of the land. இன்னைக்கு சொன்னதெல்லாம் இப்போ எக்ஸாம்பிள் எழுதுனீங்கன்னா முட்டை மார்க் வாங்குறதுக்கு வாய்ப்பு இருக்கு. ரைட்? அதுக்காண்டி இது உண்மை இல்லைன்னு ஆயிடாது. அப்ப என்ன பண்ணணும் அப்படின்னா, அறிவாளி என்ன எழுதுவான் அப்படின்னா, அக்பர் மரணட்டதையும் எழுதுவான், அக்பர் உண்மையான செஞ்சதையும் எழுதுவான். சில சமயம் என்ன செய்வான் அப்படின்னா, இந்த வாத்தியாருக்கு மரணட்டது மட்டும்தான் தெரியும் அப்படின்னா, அவர்கிட்ட பேசும்போது மரணட்டது மட்டும் பேசிட்டு, இங்க வெளியே வந்தபோது அவர் ரோடு போட்டாரு சார், அவர் நாட்டை வந்து அப்படி பண்ணாரு இப்படி பண்ணாருன்னு சேர்த்து எழுதணும். சரியா? That is what your brain is for. Context. Learn the context. சரியா? எல்லாத்தையும் அதே ஆன்சரை சொன்னோம் அப்படின்னா நம்மளை முட்டாள்ருவாங்க. சரியா? அதனால வந்து முட்டாள்கிட்ட வந்து என்ன சொல்லணும் அப்படின்னா, ஆமாங்க நீங்கள் தான் ரொம்ப நல்லவர் வல்லவர் எக்ஸ்ரேலே தெரியுது அப்படின்னு சொல்லிட்டு இங்கே வந்து பேஷண்ட்டுக்கு நல்லா சொல்லிக் கொடுங்க. சரியா? Because as I told you, you are not working for the orthopedician, you are not working for yourself, you are working for your patient. If it is your mother, what do you want to do? Take rest or make them move? எனக்கு ஒரு ட்ரீட்மெண்ட் அடுத்தவனுக்கு ஒரு ட்ரீட்மெண்ட் இருக்கக்கூடாது. சரியா? அப்படி இருந்தால் அது பேர் மெடிசன் கிடையாது, வேற. ரைட். So the next thing you want to stop saying is to take rest. Rest is not an answer. Even for rheumatoid arthritis nowadays they say that you have to do rested exercise. Again, one of my junior from my college, she is doing she has done her PhD, now she is doing a PD in rheumatoid hand, that is about doing rested exercise to rheumatoid arthritis. When I went to college, we were told never to do rested exercise for rheumatoid arthritis because there is a inflammation. But they have found out that doing rested exercise seems to be working well. Why? Because an empirical evidence is saying that it is better. Logically, it may say that it is not better. Am I clear? Right? If you have a chance, her name is Cynthia Srikesavan. She is in Facebook. She works for Oxford University. She is doing for rheumatoid arthritis. Right? So don't tell them to take rest. Don't tell them to stop from sitting on the ground and things like that. Right? And about the exercise, as I told you, there is only one thing you want to remember about exercise. You want to do graded exercise. What I mean by graded exercise is, college ஸ்கூலுக்கு போனோடனே எடுத்தோன்னே ஒரு வருஷம் பூரா என்ன படிப்போம், 1 to 10 இல்லையா? அதுக்கப்புறம் தான் வந்து 100 வரைக்கும் சொல்லிக் கொடுப்பாங்க. முதல் நாளே 100 வரைக்கும் சொல்லிக் கொடுப்பாங்க சில ஸ்கூலில். ரைட்டா? அந்த ஸ்கூலில் விளங்காத ஸ்கூல்னு அர்த்தம். அதனால தான் நம்மலாம் படிக்காமல் வந்திருக்கோம். 3ஆம் கிளாஸ்லேயே சேர்த்து 3 வயசுலேயே சேர்த்து விட்ருவாங்க. ஏர்லியராகவே ஆரம்பிச்சோம்னா பிச்சு உதறலாம் அப்படின்னு. ஒரு மண்ணாங்கட்டியும் உதற முடியாது. ரைட்? Why? Because learning happens slowly. If you are giving calculus, முதல் நாளே கால்குலஸ் சொல்லி கொடுத்தாங்க அப்படின்னா, 6ஆம் கிளாஸ் போறீங்க, முதல் நாளே கால்குலஸ் சொல்லி கொடுத்தாங்க அப்படின்னா ஒரு பையன் அதுக்கப்புறம் ஸ்கூல் போக மாட்டான். லைக்வைஸ் முதல் நாளே அரை மணி நேரம் எக்ஸசைஸ் பண்ண சொன்னீங்க அப்படின்னா no patient will come to you. But you need half an hour exercise. Because if you do 5 minutes exercise, that's not exercise. We know that it needs a lot of time to change. Right? So you want to do intermittent exercise. In intermittent exercise, mostly in terms of for OANE, they have sort of done distributed practice. How many of you know what's a distributed practice? டிஸ்ட்ரிபியூட்டட் ப்ராக்டிஸில் எப்படி இருக்கணும் அப்படின்னா, நீங்கள் எக்ஸசைஸ் செய்கிற நேரம் வந்து கம்மியாக இருக்கணும். எக்ஸசைஸ் செய்கிற நேரம் it should be shorter and your rest period should be larger. Right? The common protocol which I use, again it may not be very empirical, is if the pain is very very high, we do 2 minutes of exercise, 3 minutes of rest. 2 minutes of exercise, 3 minutes of rest. Like that, it goes for half an hour or 45 minutes. If the pain is 5 or 4 when the VAS scale is and the disability is slightly lesser, then we do 3 minutes of exercise and 2 minutes of rest. Right? Or 3 minutes of exercise and 3 minutes of rest also. Am I clear? So it depends upon the baseline pain, baseline disability, and things like that. As I told you, that exercise can be sit to stand. Mostly we do sit to stand from different type of height of stools. That's why you can see he's sitting in a slightly lower stool. There will be another green color stool. It is slightly higher. So we will have different levels of stools. We have static cycle, which we can do 3 minutes of static cycle, then rest for 2 minutes, and then do sit to stand for another 3 minutes, so that we can have again a varied practice. So we use distributed practice, we use varied practice. We also use exercises which the patient can also do it at home also. So sometimes I never use the static cycle because they can't do that in the home. Again, it's called as affordance. Whether the patient may be able to do it unsupervised, again you need to look into those things also. Am I clear? When you are teaching an exercise. Am I clear? You should be able to do it, replicate at home. Without you, they should be able to do it. Right? So fine. That's why I don't like hydrotherapy. It's a joke. It's a cruel joke. 45 million people are eating 2 times a day in our country. 45 million. Right? நம்ம என்ன பேசிட்டு இருக்கோம்னா 100 நாள் வேலைக்கு வந்தாங்கன்னா எல்லாம் சாப்பிடாம சும்மா சாப்பிட்டுட்டு இருக்காங்க. மூதை ஒரு எல்லாம் படிக்கிறது கிடையாது. ஏதாவது படத்தை பார்த்துட்டு இதுதான் எக்கனாமிக்ஸ் நினச்சிக்கிறது. அதே மாதிரி 2 வேளை சாப்பிட்டுட்டு இருக்காங்களா இவங்க ஹைட்ரோதெரப்பி கொடுத்துட்டு இருக்காங்க. அந்த லெவலில் நம்ம பேசிட்டு இருக்கோம். It cannot be implemented in most of the places, so it's just a joke, right? So write hydrotherapy in your exam, but never say that as an answer anywhere in your quizzing. That's just rude, right? But make them do whatever exercise they can which moves their and if they are saying that படி ஏறும்போது தான் வலிக்குது அப்படின்னா எப்படி எக்ஸசைஸ் பண்ணணும்? என்ன எக்ஸசைஸ் பண்ணணும்? படி ஏற தான் எக்ஸசைஸ். there is no question about it. இப்போ கிராஜுவலாக எப்படி ஏற சொல்லி கொடுக்குறது? ஸ்குவாட்டிங் பண்ணால் ஃபுல்லாக வந்துடும் இல்லையா? ஸ்டெப்போட சைஸை வந்து குறைக்க பாருங்க. ஸோ யூ கேன் ஹாவ் அ ஸ்மாலர் ஸ்டெப்பர். அகெயின் யூ கேன் சி we have 3 levels of stepper. So you can slowly do that for 2 weeks, then go higher step. Am I clear? அப்படி இல்லை அப்படின்னா ஒரு மாடி ஏறினா வலிக்குதுங்க அப்படின்னு சொன்னாங்கன்னா ஓகேங்க 4 படி மட்டும் ஏறுங்க ஒரு 10 தடவை. 10 தடவையும் ஒன்றா செய்ய வேணாம். You can do 2 times, take rest, 2 times, take rest. So these are things which you need to understand. இது எப்படி தெரியும் அப்படின்னா அவனை உட்காந்து இப்படி ஆட்டி பார்த்துட்டு இருக்கக்கூடாது. காலை நல்லா ஆடுதா குறவா ஆடுதான்னு அந்த ஆட்டத்தை வச்சு ஒன்றும் பண்ண முடியாது. எனக்கு that's not an assessment. That's an assessment for exam, but that's not an assessment. As I told you, ஆடதான் செய்யும். அது பேர் தான் ஓஎனி. அது ஆடுதான் ஆட்டி பார்க்கக்கூடாது. Am I clear? That's not the treatment. Ask your patient, what do you want to do? படி ஏறும்போது தான் வலிக்குது அப்படின்னா அதுக்கு ஏதாப்புல எக்ஸசைஸ் பண்ணணும். என்னால் கீழே உட்கார முடியல அப்படின்னா அதுக்கு ஏதாப்புல you need to build your exercise. That's what I meant when I say that assessment is not about finding what is wrong with your knee joint. You can do it or you don't want to do it. Sometimes if you do these things and அப்படி இப்படின்னு கோனியோமெட்ரி வச்சுலாம் மெஷர் பண்ணோடனே அவங்க பேஷண்ட் நீங்கள் பெரிய ஆள் நினச்சிக்கலாம். That's also very important. So do that also. But remember that is not giving you any information. Am I clear? But what is giving you information is what is the problem? Okay, can I solve that? Can I make an exercise program which is capable of solving that? Can I give information to my patient reducing the nocebo he has? They're reducing the amount of anxiety he has that the எலும்பெல்லாம் தேஞ்சு போச்சுன்ற anxiety குறைக்கிற மாதிரி என்னால் வந்து சொல்ல முடியுமா அப்படின்றதெல்லாம் தான் லேர்ன் பண்ணுறதான் அடுத்த 20 வருஷம் நீங்கள் பண்ண வேண்டிய விஷயம். ஒரே நாளில் வந்துடாது, 20 வருஷம் ஆகும் if you are lucky. Because most of you are going to do IFT and isometric exercise. Right? So if you are really lucky, you will do actual physiotherapy and help people. Most of you are not going to make money. That is the nature of physiotherapy. But if you are lucky, you are going to change people. That can be done only by healthcare professionals. So have some courage and self-respect that you are a human being able to change another human person and act accordingly. Right? Okay? Remember, you may be getting more pay if you are working as a receptionist rather than a physiotherapist, but that is not the only point of being a physiotherapist. The point is, you can change a human person, especially an older person if they are with OA. You will not believe the amount of joy they have when they can go and sit in the temple after not able to do it for 1 year. The amount of joy they can do, what they say in this area, namaskaram, right? They go and do that. If you are able to do that, the amount of joy the patient has and what you can see in their eyes, you can never get it even if you make 5 crores.